Top 5 Pandemics of the 21st Century. Number 1. SARS. Short for Severe Acute Respiratory Syndrome, SARS is a viral respiratory illness caused by a coronavirus. In 2002, SARS was first detected in the Guangdong province of China. In February 2003, SARS spread from mainland China to Hong Kong when a medical professor from Guangdong checked into Hong Kong's Metropole Hotel. Unknown to him, he was infected with SARS. During his short stay, he infected other guests from Singapore, Toronto and Hanoi. Over the next few months, SARS spread to more than 26 countries in North America, South America, Europe, and Asia. During the peak of the SARS epidemic in May 2003, many schools, hospitals and wholesale markets were closed down. Travel advice, quarantine policies and port infection control measures were set up. SARS starts with a high fever of above 38 degrees. Common symptoms are headache, body aches, mild respiratory symptoms, diarrhea and dry cough. Most patients develop pneumonia. Like COVID-19, SARS is spread through close person-to-person contact. Viral respiratory droplets can enter through our eyes, nose and mouth. After strict public control measures, SARS came to an end on July 5, 2003 when the last affected area in Taiwan was declared free of SARS transmission. In total, there were 8,096 recorded cases of infection and 774 recorded deaths. However, mortality rate is estimated to be around 15%. Number 2. H1N1. The first detection of H1N1 was in January 2009, in Mexico. Initially known as swine flu, H1N1 got its name after it caused significant confusion in the unnecessary slaughter of healthy pigs. In Egypt, a mandate for the slaughter of 400,000 pigs was issued, leading to riots by the Egyptian farmers. To avoid tension, the WHO renamed the virus to H1N1. H1N1 virus is believed to be caused by a combination of viruses from pigs, birds, and humans. Symptoms include fever, runny nose, body aches, nausea, or diarrhea. As of November 15, 2009, more than 206 countries and overseas territories have reported laboratory-confirmed cases of the pandemic influenza. The estimated death toll is 150,000 to 575,000. A disproportionate number of deaths occurred in Southeast Asia and Africa, where access to prevention and treatment resources are more likely to be limited. About 80% of the deaths were in people younger than 65 years of age. This is because older people have existing immunity, as they had exposure to older H1N1 viruses at some points in their lives. A vaccine was created in 2009 and was later included in the seasonal flu vaccine. In August 11, 2010, the WHO announced the end of the 2009 H1N1 influenza pandemic. Number 3. MERS. Short for Middle East Respiratory Syndrome, MERS was first recorded in Saudi Arabia in September 2012. MERS is a novel coronavirus, and dromedary camels are a major host for the virus. Since 2012, 27 countries have recorded cases of MERS. Approximately 80% of human cases have been reported by Saudi Arabia. Cases outside the Middle East are usually imported cases from travelers. Even though human-to-human transmission is possible, there has been no sustained human transmission documented so far. The primary way MERS virus spread is through direct, or indirect, contact with infected animals. People with weakened immune systems, older people, and people with chronic diseases, have a higher chance of contracting the virus. Symptoms include fever, cough and shortness of breath. Pneumonia is common. Gastrointestinal symptoms, including diarrhea, have also been reported. Today, there is still no vaccine or specific treatment for MERS. However, there are several vaccines for MERS in development. As of end November 2019, there were 2,494 cases and 858 deaths reported since April 2012. Even though the case fatality rate is a whopping 37.1%, many MERS cases are asymptomatic or not identifiable from other respiratory diseases. Number 4. Ebola. The first patient was identified in December 2013, in Guinea. Ebola is spread mainly in Central Africa, near tropical rainforests. Wild animals like fruit bats, porcupines, and non-human primates are suspected hosts of this virus. Ebola is spread directly through animals that are found ill or dead in the rainforest. Most cases are spread through human-to-human contact, when blood or bodily fluids enter our broken skin or mucous membranes. Humans can also become infected through butchering, cooking, or eating infected animals. Since the outbreak, investments in Guinea, Liberia, and Sierra Leone dramatically decreased. Trade in services, agricultural production, and food security were adversely affected. Symptoms of the virus include diarrhea, vomiting, rash, internal and external bleeding, and symptoms of kidney or liver failure. About 29,000 cases were recorded, and the average fatality rate is around 50%. After more than 2 years, Guinea was declared Ebola-free in June 2016. An experimental Ebola vaccine was created in 2015, and it proved very effective. Today, the Democratic Republic of the Congo is still facing Ebola, and efforts are still ongoing to administer the vaccine for the people in Congo. Number 5. COVID-19. In December 31, 2019, Chinese health officers reported 41 cases of mysterious pneumonia. Most cases are connected to Huanan Seafood Market, in Wuhan. In January 2020, China reported its first coronavirus death. 2 weeks later, China imposed a strict lockdown on Wuhan. In January 30th, WHO declared global health emergency. On February 5th, more than 3,600 passengers are quarantined on a cruise ship off the coast of Yokohama, Japan. More than 700 people were infected when the quarantine was lifted 1 month later. In March 27th, Boris Johnson tested positive for COVID-19. By April, more than a third of humanity is under some form of lockdown. Many sporting events were cancelled or postponed. Tokyo Olympics 2020, the London Marathon, Major League Soccer, EuroLeague Basketball, and Formula One are some of the events that are affected. COVID-19 most likely came from bats, and another intermediary animal host. Symptoms of the virus are fever, cough, shortness of breath, pneumonia. COVID-19 spread through close contact with infected people via mouth and nose secretions. When a person coughs, speaks or sneezes, respiratory secretions can be left on surfaces. Studies have shown that the COVID-19 virus can survive for up to 72 hours on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. Here is the top 10 countries with the most cases throughout time. As of this recording in 16th of September 2020, here are the numbers. Here is a comparison of the 5 pandemics. As always, remember to clean your hands with alcohol-based sanitizers or soap frequently. Together, we can defeat COVID-19. Stay safe.